After 60, your body stops absorbing key nutrients. Your nerves become weak and damaged slowly and silently. Then one day you can't feel your hands or feet. Most doctors never warn you about this, but I will. I'm Dr. Michael Kent, and these 4 vitamins will protect your nerves. But before we dive in, if you're watching this right now, drop a comment below and tell me your city or your age. I read every single comment personally. And if this kind of health information is important to you, hit that subscribe button right now so you never miss a video that could change your health. Welcome back, everyone. I'm Dr. Michael Kent, and today we are talking about one of the most overlooked health crises affecting seniors across the country: nerve damage. But here's what I need you to understand today. By the time most of my patients come to me with nerve symptoms, the damage has already been building for years. Sometimes 5 years, sometimes 10, and the saddest part, so much of it was preventable. Today, I'm going to walk you through the 4 most powerful vitamins that protect your nerves, rebuild nerve tissue, and keep your nervous system strong well into your 70s, 80s, and beyond. These are not trendy supplements. These are not expensive miracle pills. These are nutrients that your body genuinely needs. And after the age of 60, your ability to absorb them drops significantly. So stay with me, because this information could genuinely change the quality of your life. First, let me explain what is actually happening inside your body when nerve damage occurs. Your nervous system is an incredibly complex network. Think of it like the electrical wiring inside your home. You have billions of nerve fibers running from your brain and spinal cord all the way down to your fingertips and your toes. These nerves carry signals for movement, for sensation, for balance, for organ function. Now, surrounding each nerve fiber is something called the myelin sheath. Think of it like the rubber coating on an electrical wire. It protects the nerve and allows signals to travel fast and accurately. When the myelin sheath breaks down, when those nerve fibers get damaged or exposed, signals start to misfire. They slow down, they get confused, and that is when you start feeling symptoms. What causes this breakdown? Several things. Diabetes is a major one. Poor circulation is another. Toxins, alcohol, certain medications. But one of the biggest and most commonly ignored causes, especially in seniors, is nutritional deficiency. Your nerves need specific vitamins to function, to repair, and to protect themselves. And when those vitamins are missing from your system, the damage begins quietly in the background until one day it becomes impossible to ignore. Let's talk about each of these 4 essential vitamins one by one. The first vitamin on our list is vitamin B12. And if there is one vitamin every senior needs to know about, it is this one. B12 is absolutely essential for nerve health. It plays a direct role in the formation and maintenance of the myelin sheath, that protective coating I just described. Without enough B12, your myelin breaks down, your nerves become exposed and vulnerable, and the damage that follows can be irreversible if caught too late. Here is the frightening part. Studies show that nearly 40% of adults over the age of 60 have low or borderline B12 levels, and many of them have no idea. Why? Because B12 deficiency can develop slowly over years, and the early symptoms, fatigue, slight tingling, mild forgetfulness, are so easy to dismiss as normal aging. B12 is found naturally in meat, fish, eggs, and dairy. But here's the problem for seniors specifically. As you age, your stomach produces less of a protein called intrinsic factor, which is needed to absorb B12 from food. So even if you are eating plenty of B12-rich foods, your body may not be absorbing enough of it. This is why supplementation becomes critical after 60. The sublingual form, meaning a tablet that dissolves under your tongue, bypasses the digestive system and gets absorbed directly into your bloodstream. I recommend my patients get their B12 levels checked at their next appointment and discuss supplementation with their doctor. The recommended daily intake for seniors is between 2.4 to 2.8 micrograms, but many doctors recommend higher therapeutic doses for those who are already deficient. The second vitamin is one you have probably heard about before, but you may not know how deeply connected it is to nerve health. I am talking about vitamin D. Most people know vitamin D for bone health, but vitamin D receptors are found throughout the nervous system, in nerve cells, in the spinal cord, in the brain. Research now shows that vitamin D plays a key role in nerve repair, reducing inflammation around nerve tissue, and even protecting nerves from the kind of oxidative stress that leads to damage. Low vitamin D levels have been directly linked to increased risk of neuropathy, nerve pain, and even cognitive decline. And the numbers are alarming. Some studies suggest that over 70% of older adults are vitamin D deficient or insufficient. The primary source of vitamin D is sunlight. Your skin produces it when exposed to UV rays. But seniors spend less time outdoors. Skin becomes less efficient at producing vitamin D with age, and many seniors live in northern climates where sunlight is limited for months at a time. Food sources like fatty fish, egg yolks, and fortified milk help, but they are rarely enough on their own. This is why vitamin D3 supplementation, combined with vitamin K2 for proper absorption, is something I recommend to almost all of my senior patients. Blood levels of vitamin D should ideally sit between 40 to 60 nanograms per milliliter. Many of my patients come in well below 20. A simple blood test can tell you exactly where you stand. Now, I want to pause here and share a story with you, because statistics are important, but real people make this real. About 2 years ago, a patient came to see me. Her name was Mia. She was 67 years old, retired school teacher, incredibly sharp woman. She came in because she had been experiencing what she described as a strange buzzing in her feet for several months. At night, the bottoms of her feet would burn so badly she could not sleep. She had also started tripping occasionally, losing her balance in ways she never had before. Mia had seen 2 other doctors before coming to me. Both had told her it was probably just arthritis or circulation issues related to her age. She was told to take ibuprofen and rest more. When I ran a full nutritional panel on Mia, the results told a very different story. Her B12 levels were critically low, her vitamin D was severely deficient, her B1 levels were below normal range, and she had almost no alpha-lipoic acid activity in her system. Mia was not sick because she was old. Mia was experiencing early-stage peripheral neuropathy driven almost entirely by nutritional deficiency. Her nerves were starving. We put Mia on a structured supplementation plan, the exact 4 vitamins I am sharing with you today. Within 6 weeks, the burning in her feet had reduced by more than half. Within 4 months, she was sleeping through the night again. Within a year, her follow-up nerve conduction test showed measurable improvement. Mia cried in my office that day. She said, "Dr. Kent, I thought this was just my life now." And I told her what I want to tell every single one of you watching right now. It does not have to be. You are not powerless against this. Mia's story is not unique. I have seen it dozens of times. And the solution, more often than not, starts with these 4 vitamins. Let us continue with the 3rd vitamin, vitamin B1, also known as thiamine. Thiamine is one of the oldest known vitamins and one of the most important for neurological function. Every single nerve cell in your body requires thiamine to produce energy. Without it, your nerves literally run out of fuel. They cannot function, they cannot repair themselves, and they begin to deteriorate. Thiamine deficiency is well documented as a direct cause of peripheral neuropathy. It has also been linked to a serious neurological condition called Wernicke's encephalopathy in severe cases. And while severe thiamine deficiency is more common in people with alcohol dependence, mild to moderate deficiency is surprisingly common in the general senior population. Why? Because thiamine is a water-soluble vitamin that your body does not store in large amounts. You need a consistent daily supply, and as appetite decreases with age, as dietary variety shrinks, as certain medications interfere with absorption, thiamine levels quietly drop. Good food sources of thiamine include whole grains, legumes, nuts, and lean pork. But again, absorption is the challenge for seniors. Supplementation with B1, often as part of a B-complex supplement, ensures your nerves are getting the fuel they need every single day. The recommended daily amount for seniors is around 1.1 to 1.2 milligrams, but therapeutic doses used in neuropathy treatment are often significantly higher and should be discussed with your physician. The 4th and final vitamin, or more accurately vitamin-like compound, on our list is alpha-lipoic acid, commonly known as ALA. Now, ALA is unique for several reasons. First, it is both water-soluble and fat-soluble, which means it can work in virtually every tissue in your body, including deep inside nerve cells. Second, it is one of the most powerful antioxidants known to science. And third, it has been the subject of decades of clinical research specifically focused on neuropathy treatment. In Germany, alpha-lipoic acid has actually been an approved medical treatment for diabetic neuropathy for over 30 years. Numerous studies have shown that ALA supplementation reduces nerve pain, improves nerve conduction velocity, and helps regenerate damaged nerve fibers. How does it work? ALA neutralizes free radicals, those unstable molecules that attack and damage your nerve cells. It also helps recycle other antioxidants in your body, including vitamin C and vitamin E, multiplying their protective effect. And it helps improve blood flow to the nerves, which is critical for nerve repair and nourishment. Your body does produce small amounts of ALA naturally, and it is found in foods like spinach, broccoli, and red meat. But the amounts from food are quite small. The therapeutic doses used in clinical studies, typically 300 to 600 milligrams per day, require supplementation. If you're dealing with any nerve symptoms whatsoever, alpha-lipoic acid is one of the first supplements I reach for in my practice. So let us bring this all together. We have 4 vitamins that your nerves depend on. vitamin B12 for myelin protection and nerve signal transmission, vitamin D for nerve repair and inflammation control, vitamin B1 for nerve energy production, and alpha-lipoic acid for antioxidant protection and nerve regeneration. Each of these works differently. Each targets a different aspect of nerve health. And when they work together, when your body has adequate levels of all four, your nervous system has the tools it needs to protect itself, repair itself, and keep you feeling strong and capable. Now, I want to be very clear about something. Supplements are not a replacement for medical care. If you are experiencing significant nerve symptoms, persistent numbness, burning pain, loss of balance, weakness in your hands or feet, please see your doctor. Get a proper diagnosis, understand what is happening in your body. But here's what I can tell you with confidence after years of clinical practice. Nutritional deficiency is one of the most common and most treatable conditions